Glad we can hear you. How are you doing?
Good. Yeah, I couldn't hear anything for a while. I think I got it figured out. So
Good. All right, we'll go ahead and call this meeting to order of the Eastern Idaho Board of Health. We appreciate everybody being in attendance. We have in the room here at the Eastern Idaho Public Health Facility our physician representative, Dr. Gardner. We also have our representative from Jefferson County, Shane Young. And I believe that's all I see in the room here with us, in addition to, of course, our director, Jerry Radkow, and several members of the Eastern Idaho Public Health staff. We will go ahead and begin with a roll call. I have mentioned the two board members that are here, and so I will not repeat them, but just to ensure everybody's sound and that they're hearing us and we're hearing them. We'll go ahead and go to Madison County.
Commissioner Mendenhall here.
Thank you. Fremont County. Commissioner Dance, we see your hands. So thank you. Let's see, let's go to Clark County.
Greg Shenton here.
Lemhi County.
Commissioner Leah Manson.
You. Teton County.
Bill Lake here.
Okay, very good. Of course, I'm Brian Reed from Bonneville County and Teton County. Did I do Teton already? Okay. All right.
Still here.
And thank you, Bill. And Custer County, do we have Wayne on yet? Okay. So we're missing Custer County, but we certainly have a form. And again, appreciate everybody's attendance. We'll first go to the next item on our agenda, which is an update on the environmental health enforcement action. I understand that we have Mr. Crockett online. Can you hear us?
Yes, Mr. Chairman, I can hear you fine. Can you hear me?
Okay, yes, we can. Thank you for being here. So I will go ahead. I'll go to you. I'll go ahead, Jerry, and turn it over to you for how you want to proceed.
Thank you. And we do have Mr. Crockett on the line. If you recall, on November 4th, we had a hearing, an enforcement hearing for an illegal septic system under the Babcock's ownership, and had given until February 13th for action to be taken on that. And unfortunately, there has not been all the steps taken to come into compliance with that. And so I would turn it to Kelly Johnson if she has anything to add before we go to Greg Crockett.
Thank you, Kelly.
Yes, I would just add there were some actions taken by the Babcocks to definitely let us know that they understood that they needed to, put steps into place to take care of this. On the 18th of November, we were provided, or the staff of Jefferson County were provided a pumping report of the septic tank. And it was found that we were dealing with a concrete tank, not one that was potentially a legal type or an approved tank. So knowing that the pump was being, basically be able to be approved, we were under the understanding that there would be some provisions made to start working on an application and getting hopefully the system taken care of by the deadline. Last week, we received an application for potentially them moving forward with trying to remedy this, but no payment was received until yesterday. So the compliance of the order was to have everything taken care of or removed and witnessed by us basically by the 13th of February. So again, as Jerry mentioned, not enough steps were taken to actually close out the enforcement action. So the next steps would be the support of Greg Crockett, what we need to do next, up to the board feels is appropriate and definitely the opportunity to start collecting attorneys. So.
Okay, do you have anything to add, Mr. Crockett?
I have nothing further to add, Mr. Chairman. I think the order entered by the Board of Health was explicitly clear with and I thought at the time, a clear understanding by Mr. Babcock. Obviously, there has not been adherence, and I think next steps are certainly in order.
Okay, so one more time, Kelly, explain to us what options we are. What is that next step? What do you need?
Basically, going towards the attorney fees and then seeking further prosecution. Take care of the.
What does that look like? Do you file something in court, Mr. Crockett, or?
Well, there's a couple things here. One, the order does specify that it'll be prosecuted as a misdemeanor. And this would be Jefferson County. The normal process would be for me to ask the Jefferson County attorney to allow me to be temporarily appointed as a special prosecuting attorney for the project of filing a misdemeanor complaint against Mr. Babcock. We have at times gone to court to get a court enforcement order, and that's what basically the statutory scheme would so provide under the Administrative Procedure Act. Whether we have to take it that far or not, obviously, I think Kelly is correct. I think the board didn't make it clear that if there wasn't timely adherence to the order, that recovery of attorney's fees and costs incurred would be in order. And again, I think that would be by petition to the district court in Jefferson County.
Okay. Any discussion from the board? I'm going to go first, Commissioner Young. Jefferson.
When was the deadline?
The 13th of February.
We're 4 days past. They said 4 days past that.
And it was supposed to be fully complied with as far as either removing the system or moving forward with permitting the system.
And they were trying to move forward with committing.
That's our understanding. So getting the application just last week and not getting the payment until just yesterday, very clear that.
What else would they lack then?
We need a test hole, we need to issue the permit, and we need to actually have the system installed. And again, they were starting to work with us in November. So why waiting from November to last week to take any action? I would just have to say that it's not in accordance to the order. At this point, I don't know if you're interested in knowing where we're at with attorney fees.
Sure.
So we put a tally together, and from what was up to the hearing is $1,980. And then obviously Greg Crockett's time today and moving forward would be additional attorney fees. And then if there is obviously court fees for filing as well. So.
Well, I mean, they obviously realized that the deadline was here, if I'm interpreting this right. That's why they did finally get their fees in. They are demonstrating the desire to go ahead and get it permitted. They just have a lot more steps to work through, correct? So another option that we would have, board, correct me if I'm wrong, is to do an extension to give them just a little bit more time, recognize the effort that they did make just in the last week and give them a bit more time. But it may have to come with now recovery of attorney fees. I mean, that may be the kind of halfway step that you take with them. Comment from the board?
Mr. Chair, Bill Lake.
Go ahead, Bill.
Thank you, Mr. Chair. If I recall, back in our last meeting on this, we actually gave them an additional time. I think it was up to like 6 weeks or a month to take care of this, and they obviously didn't use that time very wisely, in my opinion. Thank you.
Other comments?
This is Commissioner Dance. Did we discuss issues of some flexibility due to weather issues?
Yeah, go ahead, Kelly.
You see, during the hearing, that was brought up, and that's where the extension was allowed. We were originally looking at around 30 days, just because we were still dealing with decent weather. And they had asked for more time, and that's where the decision was, basically the 90 days given. That's where the February 13th date came from.
Okay, thank you.
Mr. Chairman, I'm having a little trouble hearing Jerry or Kelly. I don't know if she's right by a mic or what, but
We just ask everyone when you speak to speak much louder, please.
So I had mentioned, Greg, that during the hearing, we had originally planned for like 30 days to remedy this situation, because we were still in decent weather at the time. And for their request, they asked for more time, and that's where we did grant them, or the board granted them through February 13th. So roughly 90 days to have taken care of the actions needed.
okay. And it's my understanding they did submit something like this week.
Just last week, they finally made the application. We did not receive payment until yesterday, but there was work by the Babcocks on November 18th to us, providing us a pumping report. So again, they've had since November to the 13th of February to have been able to take care of this situation.
Okay, thanks. And did I understand, Chairman, that you mentioned that we do have the option to give them an extension if the board desired?
Well, I believe we would certainly have that option. Correct me if I'm wrong, Mr. Crockett, but that could be an option that we could take on this.
I certainly think that is a matter with of discretion with the Board of Health. Certainly, I would agree. This is back based on the order that was entered, and of course had that February 13th deadline having expired. I'm a little curious that if there are reasons for allowance for their time, why the Babcocks didn't already ask for more time. I'm not sure that I hear Kelly say that they've been in contact with us other than to get the permit. And then recently paid the money. I'm not sure that I hear that they've actually asked for further time.
Okay. Yes, it appears that's correct. So, go ahead.
Mr. Chair, so on the application, Kelly, what does that actually do? Does that mean that they say exactly what they're going to do? Or does it just say, we're going to do something?
It's just applying for an installation permit. And then that is what we use there for after to work with the applicant to get the needed on-site, where we look at a test hole. And then from there, we issue the permit, and then it would be still up to them to install the system.
Okay, so I guess make sure I understand. So by submitting the application, they still have next steps to go through, but does that mean, is there a time limit on doing those steps, or is it, they could do it next year?
The permit to install is good for 1 year.
1 year.
So again, I guess the point of today is to just let the board know that they did not comply with the order.
I believe that our objective should be to have a proper permitted working system, on that property. I mean, that should be our ultimate desire. And I personally, and I'll go ahead and weigh in as the chair, but I respect the decision of the board. I would be inclined to give them another 30 days with a letter from Mr. Crockett stating, giving them one last timeline with the clear understanding that at that time they would be charged for the attorney fees, that we would pursue the misdemeanor. I would bring the full weight upon it at that time, but that would probably be the way that I would go, just with a hope of then getting a proper system at that time. I'm afraid if we go forward right now with attorney fees and everything, that it may stagnate and we might not get anywhere with this, except a long protracted fight.
Mr. Chairman, may I ask Kelly a question? Kelly, if you ran across a improper system, is there anything in our statutes or any authorities that we have that provides a fine per day as long as the system is being used? Is there anything that if we found one, not this particular case, but I guess what I'm looking at is I've never been one with my children to count to 3. I don't like to do that. Once I chat with them about whatever's going on, we either correct it or we go or whatever happens. But I don't want to have that hearing that we had. I would prefer not to have that hearing we had and tell them, if you don't correct this, we're going to do something. And now to come back and say, well, we're not sure what we're going to do. We'll give you one more chance. Kelly, I'm looking to see if there is anything that says $100 a day, $200 a day, if the system is being used, if there are people there. Do we have anything like that?
Yeah, letters that were written that actually brought this to the board, many letters trying to get them to comply. It actually talks about $1,000 per day penalty up to $10,000 per day for criminal violations.
Would
So
it be up to?
Sorry,
Would it be up to $1,000 a day? Mr. Chairman, what I'm proposing is perhaps if it's inhabited at this time, if there are people living there and using that system that is a failed system and is not working, we begin that fine, and we begin that fine today or the 13th or whatever it might be of $100, $200 a day. And if it's not corrected, it will be added to the attorney fees. It will be added to whatever it might be. I'm just concerned that if we just say, okay, you still have another 30 days, in 29 days, we'll be back here talking about the same thing.
And that may be, it is disappointing. We warned them last November that they needed to do it quickly because winter was coming. And so you may be correct.
And I don't know, that may be too harsh. I just want to get their attention and I don't want to make it hurt, but I want them to get it fixed or get off.
Okay, Commissioner Young.
Is this system, it is being used right now?
Yeah.
I believe the trailer itself is unoccupied. At least that was at the time of the hearing.
Okay.
And from the application, it looks like they may be putting maybe a different trailer on. It's requesting up to 4 bedrooms. I believe the trailer that was there before, or at least during the time of the hearing, was a single wide trailer. So I think they are looking at doing some improvements. So, to actually know for sure, we haven't been on the property.
I guess that's kind of my feeling. If it's not being used right now, that maybe
Yeah. And so, Mr. Chairman, with that, of what Commissioner Young is saying, if it's not being used right now, yes, we have said to them, you need to fix this. But if it's not being used, is there a violation? There was, because it was being used. Now it's not. Is there a violation until somebody moves back on that property? And Mr. Crockett might be able to help us there. Kelly, I don't know.
Yeah, I would seek Greg's opinion on that.
My off the cuff opinion is that wouldn't, I think, present an enforcement problem since
Yeah.
I agree with Kelly. At the time of the hearing, it was fairly apparent that the trailer that was there was in fact unoccupied. And although as I recall, the inspector had been by there in the previous several months and it was being occupied. But I do think that whether or not there's anybody living there is an issue. One, we don't know whether there's anybody living there at the moment. So I guess we'd have to resolve that. But if it's not occupied, I think then that would raise a question in my mind as to whether or not there was any sort of continuing violation that would invoke a daily or per diem penalty under the regulations. So I do think that's an issue. And it would seem logical that the delay in occupancy is probably some rationale for their delay in getting the system fixed anyway. So yes, my answer to that is whether or not it's being occupied is an issue in my mind.
Mr. Chair, Bill Lake.
Go ahead, Bill.
Kelly, you said there was did they have it pumped out? You said something about a pumping something?
Yes, we received a pumping report and it helped to clarify that we are dealing with a concrete tank. Originally, it was concerned that there could be just either a hole in the ground or maybe cinder blocks, so an unapprovable containment situation. So with the pumping report, we were able to confirm that it was a concrete tank, anticipating 1,000-gallon tank. So that's where our understanding was they were going to be moving forward with trying to, improve the system and, actually make it a valuable system.
Okay, thank you, Kelly. With that said, it sounds like to me that if we can confirm that they're not actually using the system and that they've got an application submitted with payment, that they have a year to get a system in place under that application, and maybe just a letter from our health department telling them that they can't use it until they get the system, upgraded or whatever it takes in compliance with the application would maybe be a solution here. Thank you.
Are there other opinions or comments from the board?
Mr. Chair, this is Commissioner Dance. First of all, I lost my train of thought because of stage fright. So, Kelly, I don't want to demean your position and your requirements that you need to follow and do, but I have a question. What are some of the improvements? Is there a new drain field that's being looked at with this application? Have they provided you with some sort of drawings and have anticipated work to be done?
With the application that was turned in, it is documented, or they've provided an actual floor plan that it's going to be a 4-bedroom trailer. So again, I believe it's going to be a new trailer, or at least a different trailer being put on. When we issue the permit, we're going to be basing the sizing of the septic system on the number of bedrooms and the soil types. So that has yet to be, calculated, because we still need to see a test hole. And that has been communicated with the property owners, that that test hole is needed for us to issue the permit, and then we'll calculate the sizing, and it will be better than obviously what's in the ground now, but they're deciding to put in a new system, is our understanding, instead of proving what's maybe in the ground that they didn't do themselves, because they can do more harm than good by trying to prove what's there by digging up and not knowing where the system is. So, you know, we're speculating that that is the plan, is to put in a whole new drain filled area.
Okay, that helped.
Thank you. Commissioner Butts, you had a comment? Commissioner Butts, can you hear me? We are not hearing you, but it appears I see your hand up, so please go ahead and chime in as soon as you can get audio. But we'll move on right now. Is there any other comment?
I believe Leah had a comment, Mr. Chairman. Commissioner
Okay, go ahead.
Madsen.
Commissioner Madsen.
Mr. Chairman, this is Commissioner Madsen. I'm just asking, has the family or the people identified any kind of struggle with maybe finding a contractor to complete the project? Is that maybe what maybe might be the holdup? Or because I know, you know, manpower, work power for anything here in our county, it's a waiting list to get stuff done. So maybe that's a question for Kelly. So
There's been no declaration of hardship.
Okay.
And again, for an extension.
okay.
Okay.
So
Commissioner Butts, wondering if we've got you yet. So any other comment? Like to bring this to a close? Yes,
Just one more.
Commissioner
Kelly,
Young.
Kelly, in your opinion, where the septic tank's been pumped, and if nobody's using that in these facilities, is there any kind of danger, environmental danger by updating this immediately? Or contamination?
well, again, we have no permit on file, so I can't say that what's in the ground obviously is in contamination. What's maybe been put into the system, I don't know if it's had any impact. Obviously, if it's not being used, no additional flows are going into it. So as it stands with our assumptions that it's not being used, you know, no harm is being done. It's just the fact that, again, starting something in November, waiting until the days before the deadline to submit application, it just feels unfortunate that we're not getting compliance. And I would just say from past situations where we've dealt with others, there has been consequences.
I do remember when they were here, they were very concerned because they didn't have a lot of time for the ground troubles. And if they didn't get it done before the ground troubles, they were worried about being able to get it done.
Go ahead, Stephen Thomas.
As fiscal officer, I guess, generally speaking, government and miss deadlines, there's a financial penalty. From the district's perspective, what we're out is extra legal costs. So can we, like Bill said, if it's not actually contaminating further, they have a year under a permit, but maybe we just could say, hey, pay us these costs, the $1,000 and some dollars that we're out of pocket, and that makes us whole financially, puts the onus back on them for not having met the original board determination, while giving them, you know, you can't occupy this until you have a functioning legal system, but not just totally letting them off, putting us back full financially, and giving them a really clear path forward. Basically, they haven't dug out the system, but I wouldn't want to let them leave us in a lurch.
Okay, other comments?
I'm Mr. Chair, Bill Lake. Hopefully for the last time, I would propose that we issue a letter that requires them to pay the penalty or legal fees, whatever, up to this point. And that in that letter, we also clearly state that we've got their application on file and that we expect them to complete it in the time frame allotted, which holds them accountable for what we told them we were going to do, but it also gives us that path forward to let them finish the job, assuming that they make the payments and everything. Something to that effect. Thank you.
Okay. You want to make that in a motion?
I'll make that as a motion to proceed as I just discussed.
Okay. Please restate it.
That the department, the health department, not Mr. Crockett at this point, maybe, or at this point, that we will issue a letter saying that they owe us the legal fees or whatever penalties we had stipulated before, and that we're in receipt of their application, and that we expect them to proceed with completing the installation of a viable septic system.
Okay, thank you, Bill. Is there a second to that motion?
Mr. Chairman, yeah, call the question. I'd like to amend that.
Just hold that thought 1 second, Commissioner Mendenhall. Okay. Commissioner Young had a question right here.
We're not going to put a 30-day, any time limits on the motion then.
Okay, there was a question if there'd be a time limit. Commissioner Mendenhall?
Well, the discussion we've had in the direction that we're headed, I agree with Mr. Lake that we need to notify them that they are still liable for costs we incurred when we went through the hearing. But I go back to the original idea that it's not occupied. And so I'm not sure that we can force them, that we can require them to make it a workable system. Rather, I would rather see us notify them that it is not an operable system. And we do have, as Bill said, as Mr. Lake said, we have their application on hand prior to any occupant being on that property. It must be brought into compliance. Failure to do so will begin immediately $1,000 a day fine. And leave it at that. They can fix it whenever they want now, as long as there's no, that's the way I'm looking at it. If there's nobody there, where are we stepping in telling them that they have to fix the system? It's when they try to put somebody back in there that we would tell them and notify them now in a letter that it would be immediate $1,000 a day fine and all legal actions would become to bear full force.
Okay, let's go this way. First, I'm gonna remove the motion for lack of a second, and then I'll go to Kelly.
I would just ask that in lieu of myself writing the letter, that I would ask that we seek the support of legal counsel to make sure that the legalese are in the letter and helping to define to how the fee will be paid. I don't want to make any mistake that doesn't stand in court.
Yeah, I think it would be worth our money to have Mr. Crockett issue the letter. And so it does come with a little more weight in it. We are following our legal channels. And so I agree with that. I think the letter should come from our counsel from here forward, probably any correspondence.
Mr. Chair,
would there be someone willing to make another motion, or Bill, would you like to amend that and make another motion?
Mr. Chair, I would like to amend my motion.
Go ahead and make a new motion.
I'll make a new motion. Make a motion that Eastern Iowa Public Health legal attorney Greg Crockett send a letter to the applicants requiring them to pay any fees or penalties that they've incurred to date, and that it also be very clear that they're expected to install a workable septic system prior to any occupancy of that facility or that trailer in the future.
This is Commissioner Dance. If a second is in order, I would so make a second.
Okay, we do have a motion and a second. So we have a motion on the floor to have Mr. Crockett send out a letter to the Babcocks that would inform them that they are, the attorney fees are now due and will be issued to them, and that they, before any occupancy, that they are required to complete the system. I think we would also include in the letter that we are in receipt of their permit, acknowledge that. The application, yeah. And there's a second discussion on the motion. Commissioner Young.
Yeah, so in the letter, they would include a penalty if somebody occupies the place, and there's a penalty if somebody occupies it before it has a workable system.
Okay, Commissioner Young just said that, does the motion include that language that would include that if someone did live in the trailer before the system was permitted, that there would be penalties?
Well, I hope
think
so.
Yeah, that would be part of the letter. It seems like that would be part of it, a full explanation. Other discussion on the motion? Hearing none. We'll go ahead and do a roll call vote on the motion then. We'll first go to Jefferson County.
Aye.
Madison County.
Aye.
Fremont County.
Aye.
Clark County.
Aye.
Lemhi.
Aye.
Custer County. Still having a hard time hooking Commissioner Butts up. Teton County.
Aye.
Our physician, Dr. Gardner.
Aye.
Did I miss anyone? Okay, chair votes aye, and so it's unanimous. So that'll be the position going forward. Do you have any questions, Mr. Crockett?
I think I've got the detail down here. And with respect to the motion that was approved, and we'll go ahead and work with Kelly in getting a letter out probably by the end of business tomorrow. So yes, I have a clear understanding of that.
Okay, very good. Is there anything else, Kelly?
No.
Okay, very good. Thank you.
Mr. Chairman,
Appreciate it.
Mr.
Go
Chairman,
ahead.
may I be excused?
Yes. Thank you for helping us with that matter.
Thank you.
Okay, very good. Those are always difficult, so appreciate all the board members, and I believe that we've got a good plan going forward. So we'll go ahead and move to item number 3, public comment. There has been no public comment received, and we do not have any public in the meeting room with us today to comment. So, and there is no one on the line that was provided for public comment. So we'll move to the consent agenda. Everyone received by email, and it's on our website, the consent agenda, which includes the approval of the January 20th meeting minutes, the sub-grant review and approval, and the current year-to-date fiscal year 22 financial report. Is there any questions or comments on those items?
Mr. Chair, Bill Lake.
Go ahead, Bill.
On the grants, there was a line item there that said PKU, and I'm not familiar with what PKU is.
Okay. Okay, we'll go ahead and get an explanation here. Go ahead.
PKU is phenylketonuria, and it's one of those diseases that's detected as soon as the baby is born. And so we are the boots on the ground when we have a new child in our district who has that disease. They require a special formula. They require as individual care by doctors up in Oregon and in dietitians in Boise. And so that's what our grant is to take care of those babies that have that issue. And we also have clinics for the adults with PKU as well.
Okay, very good.
Thank you.
Are there any other questions? I need a motion then to approve the consent agenda.
Mr. Chair, I'll make a motion to approve the consent agenda.
Okay,
I would
motion's been
second
made.
that.
Commissioner Young, and second by Commissioner Mendenhall. Any discussion?
Second.
Okay, all in favor, say aye.
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 Anyone opposed? All right, thank you. We'll next move to our COVID-19 situational report. I think we are all very happy with the trend in the numbers recently, and the hospitalizations have been going down. Appreciate all that. So I'll turn the time to you, Director Recca.
Yeah, thank you, Mr. Chairman. It certainly has been a roller coaster of a ride the last month or 6 weeks. I wanted to just share a couple of pages on our dashboard and talk about hospitalizations. I'm going to ask James Corbett to help fill in some commentary here for us.
So yeah, as Jerry's showing right here, this is our district level data. You can see that large spike when we last met in January. It was kind of right at that peak or very close to the peak. We were hopeful that it was going to go down very soon. That's come to fruition. And you can see even 3 weeks ago, we were having cases close to 1,000 a day being reported to us. Again, this is just the data that's reported to us. We know that there's maybe items out there that aren't reported to us or home tests, as well as other individuals that choose not to get tested. However, it's a good understanding of the disease prevalence in the community. So again, that very high spike is indicative that hospitalizations have again followed that same trend. You can see that very high peak that we saw in cases did not necessarily come to fruition in hospitalized cases of individuals within our health district. There was a surge, but it was not past the surges or indicative of a 3 times the amount. So again, we avoided that, and we are dropping very quickly on hospitalized patients as well. We put together, just as we've had more time, we've been able to put together a little bit more information that we'll show you here. It kind of explains what we've seen over the last few years. This is, and I think we've given it to those in the room. So right now, you can see this is by the number of cases. So this is what's reported to us. And we kind of have 3 distinct sections of the pandemic that we broke it out into. That first year, not much information changed. So you can see from that first year, kind of March to a little over a year to June 30th, we had about overall, this is again by cases, I'll show you by population just in a moment, but 4% of the cases were hospitalized, 17% of those were in the ICU, and almost 1% of cases died. So almost 1 per 100 individuals died of the cases that were reported to us. As we moved into the Delta wave, as we could say, the fall of 2021, that increased actually to 4.6% of the cases were hospitalized, a little bit more in the ICU, and just slightly higher in death. So the Delta was, as we, we're getting those reports, slightly more. We did break it down into vaccinated versus not vaccinated for cases. We didn't do that at that first wave, I'll just point out, because there was no vaccine. So again, until we got to that last fall where we felt comfortable that everyone had an opportunity to become vaccinated. Again, the difference between vaccinated and not fully vaccinated in how many individuals were going to the hospital, how many were in the ICU, and percent passing away. The Omicron is where the big difference is. 1.6% of the cases were hospitalized, so a drastic decrease. Still 15% in the ICU, but had decreased, and much lower overall death as well. We, in the box in the lower left corner, we actually can use that to compare to the annual flu that we see. So this is an average of the last 10 years from CDC flu estimates. 1.5% of cases are hospitalized, and 0.1, just a little over 0.1 of the cases died. So almost very, very similar to what we saw with the Omicron surge. So again, we'll kind of take that as. But overall, the average of the pandemic waves, again, 3.6%. So really 2 to 3 times percent of as many people are hospitalized with COVID-19 over the last 2 years, and certainly, about 7 times the amount of people passed away compared to an average flu. So this is per 10,000 population. The second slide that we're getting to, this is just we work off of deaths and hospitalizations because those are a static, we can count on those. Like I just mentioned previously, we can't necessarily understand who may or may not have tested, but we do know from either doctor's reports or coroners who actually have passed away, and from all the hospitals, we know how many people are hospitalized with COVID. So this is based off of a 10,000 population and not off cases. It's and we work backwards a little bit from hospitalized by the population. So again, 47 per 10,000 individuals. We did leave this in per 10,000 individuals to kind of help understand. 47 per 10,000 individuals were hospitalized, 17% in the ICU, 11 per 10,000 individuals passed away. That's in our population. That's not cases. I'll reiterate that point. Compare, I'm just going to kind of skip over. You can go through this later, but the Delta was a little bit better for hospitalizations. I think that's partially due to our hospitals being slightly overwhelmed and sending some sick people home at times that they probably would have previously hospitalized. But again, for Omicron, we'll go to Omicron, 9 per 10,000. So a drastic drop. Again, 15% in the ICU, not too much drop in that. And then 0.9 per 10,000 population data. So again, much lower death, much lower hospitalization for Omicron. In that box, again, we averaged the CDC flu estimates per 10,000 population to give you an idea of just the entire community. 13 per 10,000 individuals are normally hospitalized on any given year. And then 1 per 10,000 individuals die from flu. Compare that with the average of the waves that we saw, or the total number of cases, 26.5 per 10,000 hospitalized and 5.9 per 10,000 population passed away. So again, twice as likely to be hospitalized than a normal flu for 10,000 population, and almost 6 times the amount of death that we normally see from flu. So overall, that starts to get into perspective of that question that's come up normal, how much more serious is this compared to what we've seen with flu or other diseases? This is a good indication of that. So we'll keep doing that. Questions?
Just a couple of other comments.
Yeah.
Not a lot has changed in the vaccination role. If there are questions, Amy is happy to answer those. Our hospitals are doing better than they were when we were sitting here at our meeting last month. And the blood supply situation is improving, especially in our health district. There's not a serious concern at the moment. And we have also made available KN95 masks that were provided by the state. We've made them available in all of our 8 counties for any individual that is interested in getting those. And that's what I can think of right now.
Yeah, if I may, just one last thing. We, at the peak of the cases of Omicron, I think I reported actually last meeting, we were slightly behind at that time. My team, I can't speak highly enough of again, they quickly remedied that and we were back in case counts within a matter of a week to 10 days. So it was only a week to 10 days. I'll tell you right now, the state of Idaho across all of their health districts, there's still about 30,000 outstanding. So their districts are still getting some of that backlog in, but our district and my staff is getting that so people can make appropriate decisions.
And then just one last comment. Idaho Department of Health and Welfare has been doing weekly press conferences related to COVID-19. They're typically on Tuesday afternoons and they're available on YouTube. They are going to be changing to every other week now, starting in 2 weeks. So.
That's fantastic. Dr. Gardner.
Yeah, James, just a quick question. Are you hearing or seeing any information that from the CDC or otherwise that is offering any predictions of future surges or waves, or was seeing that anywhere across the world? I can't say that I've seen anything reliable myself, but I'm not in the information as much as you are.
Yeah, good question. Reliable? No. I think there's supposition at all times, but for reliability, right now, we don't have any new variants that have been identified that are causing necessarily concerns. There is still subvariants of the Omicron are very closely tied together that they're, but whether that is another surge or whether that's just part of that Omicron surge. Again, I think we know what we know about this disease is that immunity, whether naturally or vaccine induced, wanes over time. So are we completely done with COVID-19 or SARS-CoV-2, the virus that actually causes that disease? No. Am I hopeful that we're going to get more towards a seasonal or a flu type numbers? Yes. Do we still want individuals to die or to be concerned with that? No. So what recommendations will be coming forward? Too early to tell.
And Jerry, can I make one comment real quick? On the vaccinated cases, the state, the last 8 weeks, has broke those out even further from fully vaccinated to those that are boosted. Those that were boosted in that time period, it probably dropped cases and deaths by about 2/3. So the booster dose definitely had an impact. So I just wanted to know that.
Okay, thank you. Are there other questions from board members online? This I think is really interesting information. James, I appreciate you putting this together. It really paints a picture of the whole 2 years and shows, number one, how important all of the work that we did early was before there were protections out there. Also, how important the vaccine has been and able to control hospitalizations and deaths. I suspect that Delta would have been much worse had we not had some vaccine at that time. And then, of course, just really glad for the fact that the Omicron has been less severe as far as illness goes. So thank you for this information. It is really good. One question that I would have, for James or Dr. Gardner is, when does this go from pandemic to endemic? What is the clinical definition of that?
Better this than me.
So I think we're very close to that. I think it can stabilize for us. You know, certainly the World Health Organization actually is the one who determines pandemic versus pandemic. But I would say we're very close to this being endemic to whatever we're seeing, and not necessarily a pandemic situation. However, I think we spoke about this actually probably in some of our first meetings with COVID-19. Really, society sets how much concern we have for any given disease. We make what is acceptable hospitalization deaths by our actions. And I think individuals have shown that they're willing to accept the amount. And, you know, in America, certainly, you know, every location is a little bit different what their society is accepting of by actions and then by mandates or laws or whatever they'd like to bring forth. So regardless of whether, I think we stated this last time, regardless of whether it's endemic or pandemic, this amount of cases in one time could be a cause for concern just for the amount of hospitalizations and deaths, and we want to be aware of it. But I think if I had to make a prediction, and I don't like making predictions, but so just know that this is worth nothing probably, but probably summerish timeframe that the World Health Organization makes a declaration and you know, out of the pandemic phase of this disease.
Thank you, Dr. Gardner.
I think the other thing that will be very interesting to see unfold over the next year or two is to see how COVID settles in with the other seasonal things that we're used to. It's been fascinating to see flu almost disappear. It's still out there, and I don't have the numbers, but really waned. And then to see how that how it affected RSV, to have RSV show up in the middle of summer last year, to have such a rough season, but currently the burden's very low, RSV. So see how that all settles out and what becomes seasonal and what those seasons are. You know, we've been in a pretty steady pattern for decades, and to see how this has disrupted and will continue to disrupt the patterns that we're used to and kind of reset things. I think it'll be very interesting. The job security for the health department.
It's interesting.
No, I just agree. Yeah, we're very interested to see where this kind of flows out because it hasn't interrupted since day one, really, the flu numbers and
Okay, well, thank you. And I just want to say again, thank you to everyone here at Eastern Idaho Public Health for all your work the last few years. It's evident of the effectiveness by how Eastern Idaho Public Health has always caught and been current with cases, with vaccinations, for the entire part of this pandemic in the last 2 years. Eastern Idaho Public Health has really led the way in how this has been handled. And so it starts with the leadership of our director right down to the leadership of every one of you as division directors. So thank you for everything that you've done this year. It really has made a difference in our community. One side note, as commissioners, we're all glad that we're very close now to be able to begin jury trials again, which have been stopped due to the high numbers. And, you know, the backlog in the justice system was building. So we're all glad that jury trials are able to begin, and we hope that everything continues to improve. Without any other comment, we'll move on to our update on House Bill 316 and some other matters. I'll turn it over to you, Director.
All right, thank you. These next few topics were really the the main purpose of today's meeting, because we are quickly approaching the March 1st deadline for House Bill 316 to be implemented. We have been working very hard over the last 6 months to get things in order in preparation for the March 1st date, and we're very close. And so I'm bringing to you today some MOUs that I just wanted to review with you prior to signing them, that will impact how things function going forward. And I'll just start with the first one, is with the State Controller's Office. So the State Controller's Office is used for all of our accounting purposes, our payroll, the electronic system that we do our performance evaluations is included in there. And the Controller's Office staff has been very helpful working with us to ensure that we're able to continue those services going forward. And so in the packet was the draft MOU that has been created. Our district will be the last one to actually sign. All the districts have signed on at this point. But it just talks through the functioning of the relationship between the health districts and the State Controller's Office going forward. So I don't know if you want me to go section by section through that, or if you've had an opportunity to look at it and have any questions that you'd like me to answer. I feel very comfortable with where we have landed with this MOU. It does give us a good timeline if we want to terminate the agreement with them, which we have the ability to do anytime, a 6-month timeline for notice. And there are some, with this, the term is through June of 2026. I've shared in the past that the state is adopting an entirely new platform called Luma that will take the place of EIPH, the STARS, and iPerform, all of these separate components that allow us to do our business. The first piece of that is going live in January, and then next June will be another phase rolled out. And the payment that we have been charged for use of the Controller's Office will not change until 2026 because of the way that it is calculated and then charged out. We don't know exactly what the new payment structure will be, but they will share that information with us as soon as they have it available. But Steve has been very helpful in conversations with the Controller's Office to make sure things are in order, and I feel very comfortable with the summary that I presented today. So unless there's questions, I guess I would ask for your approval to allow me to sign them.
Okay. It was presented to everyone. It is quite lengthy. I went through it and it seemed, very comprehensive. Are there any questions or concerns with it from the board? Okay, if not, I need a motion to approve that, and if the authority of our director to move forward with signing that.
Mr. Chairman, this is Commissioner Mendenhall. I would make a motion, we approve the interagency agreement for payroll and accounting services with the state controller.
Okay, is there a
Commissioner
second?
Shenton, I'll second it.
Okay, we have a motion and a second. Is there any discussion? Seeing none, all in favor, say aye.
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 Any opposed? Okay, thank you.
All right, the next item is the MOU with the Idaho Office of Group Insurance. This is where we get our medical, dental, life insurance benefits through. And we are still entitled to participate in the Office of Group Insurance through Idaho Code. And so they had just asked that we, as a separate now political subdivision, that we enter into this MOU with them. And again, I have read it, feel very comfortable with it, and again, would ask for your blessing on the signing.
Okay, any concerns from the board? Okay, I'm ready for a motion.
This is Commissioner Dance. I'll make that motion to approve.
Okay, motion by Commissioner Dance and a second by Commissioner Young to approve that. Any discussion? All in favor, say aye.
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 For anyone opposed? Okay, thank you.
Before we move on to item C, I just wanted to report that we are in continued discussions with the Division of Human Resources. And there will likely be some type of agreement that will come forward with them, depending on what services each individual health district chooses to continue having them provide. With the passage, assuming that it happens with House Bills 515 and 516, that removes us from the personnel rules. But DHR has historically provided training opportunities for us. So like for our cybersecurity training, respectful workplace training, other state-sponsored educational opportunities for staff, like the Supervisory Academy or the Certified Public Manager training. And so there is continuing dialogue with what that looks like going forward, and some mutual agreement for each individual health district. And I will tell you, it looks different for each health district. We currently pay about just a little over $19,000 for services provided to the health district through Division of Human Resources. And there's dialogue of what that fee looks like going forward as well as of March 1st. And in fact, we have a conference call this afternoon with DHR to continue those discussions. So not prepared to bring forth anything at this point until we have some more clarity on that. But as we move on to House Bills 515 and 516, those are the two cleanup bills that Division of Human Resources is sponsoring this session. They did pass the House yesterday, both of them. And really what it does is clean up the language in there that says that the health districts are no longer required to participate in the state's personnel system, and gives that complete authority to the board for personnel oversight. So they'll move on to the Senate side, and I don't anticipate any challenges with those bills. The next item is an update on the risk management insurance piece. And as I shared last time, this was a little bit of a surprise to us that there was some dialogue from risk management because of House Bill 316 that the health districts were no longer able to be covered by state risk management, where we had been under their coverage for our entire history. There's been a lot of dialogue occurring since then with Department of Administration, with the Attorney General's office, with Mike Kane, our legal counsel, and others. And at this point, it looks like there may be a legislative solution coming forward as early as next week to strengthen the language that was in 316 to solidify that it does allow us to continue under state risk management. That is a significant issue for us. We currently pay about $33,000 a year for our insurance coverage through the state risk management program. We have had conversations with ICRIM as well as a private insurance provider. And if we're not able to continue under risk management, it will increase our costs significantly, many times over, which is then just an added cost to our taxpayers. That was shared also with JFAC. We had the health districts did a presentation to JFAC on Monday of this week. And we shared that information there as well. So we are very hopeful that there will be a legislative solution that keeps that in place and doesn't put that extra cost burden onto the taxpayers of the state. Any questions that anyone has as far as the transition? Again, March 1st is the effective date, but things I feel are fairly well in order.
Seems like a long ways ago, but now it's right here to us. So, yeah, no, and I know there was a lot of lobbying at our IAC meeting for the risk management for the insurance, and so I'm glad to hear that there may be a solution coming forward on that. Any other questions, comments? Okay, we'll go ahead and move on to our employee handbook. As you remember, we reviewed that quite extensively at our last meeting. I think there were a couple of recommendations came out of that, and so where are we with that?
So I took the policies that we had presented to you last time and incorporated them into our approved employee handbook. And so you'll see in your packet, and this is a much more comprehensive 85 pages or so of policies. In the revised handbook, which we have brought and had approval from the board in the past, changes that incorporated the new HR policies were identified in red, so you could see those. One question that was left hanging last time was the need to include a name clearing hearing, and that is a requirement. And so I've incorporated that back into the policy, as well as that process for those, the handling of those types of hearings. We did make some other changes to some of the policies in here as we had the opportunity to review and update. Some other updates have been made. They are identified with strike-throughs or potentially highlights in some areas. But I would ask if there are any questions. I'm happy to answer any related to the policies. Otherwise, ask for approval by the board.
Like I say, we reviewed this pretty well last meeting. Are there questions or thoughts that have come out since then, or concerns? Okay, I'm not hearing any, so we do need a motion to approve this so that it can then be implemented.
I motion that we approve the East Idaho Public Health Employee Handbook.
Okay, thank you, Commissioner. Is there a second?
Second, Commissioner Mendenhall.
Okay, there's a motion and a second. Is there any discussion? Okay, all in favor, say aye.
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 Anyone opposed? All right, very good. Thank you. Well, I think we've completed a lot of good work here. There's one more issue.
Yeah, just a couple of announcements.
Okay.
Things that we have discussed in the past, and we did have a executive council meeting. I can't remember the date, but just an announcement of where things are on a couple of items that were discussed there. The first is the Millennium Fund. I had reported at our last meeting that the health districts had submitted a budget request to JFAC for about $800,000 in Millennium Fund dollars that is used by public health districts to provide free tobacco cessation services to residents of our health district. When the governor's budget recommendation came out, he had zeroed that out. The Millennium Fund itself has met twice now, once last Thursday and once on Monday of this week. Public Health did have an opportunity to present at the Millennium Fund Committee, and there were lots of questions asked about the removal of the funding from Public Health. We were also asked to provide a proposal of what it would look like to do more prevention work with younger kids on tobacco prevention. So vaping in particular was discussed at length. And so I want to recognize James and his peers across the state that Thursday very quickly pulled together some information to be able to provide to the Millennium Fund Committee on Friday for consideration and action on Monday. And so the Millennium Fund did meet again on Monday. They made their recommendation, which did include the nearly $800,000 in continuing tobacco cessation funding, as well as nearly $1 million in additional funding for this added prevention work. And they called it a pilot project to be implemented. The proposal was for, in one school in each health district with the additional funding that they've allocated. I don't know really what that would look like if in fact that's approved. But the next step is that JFAC will actually take action on the Millennium Fund Committee's recommendation, and that's scheduled for February 22nd. So we really won't know until JFAC acts, and then in fact the legislator would then have to approve the JFAC's recommendation. So it could still be several weeks before we really know what happens with the Millennium Fund. But we do appreciate the support of the Millennium Fund Committee on the important work that's done with tobacco prevention and cessation services. The last item is an update on the opioid settlement, and things are getting very close. We had been informed that All of the counties and cities that were eligible for participation within our 8-county health district had signed on, but there was one special district, the Bonneville County Fire District, had not yet signed on. And with the assistance of Chairman Reed, he and I were able to facilitate conversation with the fire district, and they got their sign-on paperwork completed, and that was submitted to the state as well. So the last that I heard, there maybe were 2 counties that they were waiting on, but almost 100% participation from the eligible entities in Idaho, which is very encouraging. The next step is that we should see around April, potentially the first payment coming from that settlement. And then July would be the second one that comes from the manufacturer, Johnson & Johnson. So I would propose that in the next meeting, maybe we have a more lengthy discussion on that, as we had talked in the past, that it would be my desire that we bring to the table all of the entities in our health district that have signed on, and maybe have some dialogue of what it looks like in our health district, activities to be undertaken with the opioid settlement funds. So we'll bring that at a future meeting for more dialogue.
Okay.
That's it.
All right, very good. Next meeting date?
March 17th, so just 1 month from today, at 9 a.m. I would anticipate that being our full day meeting, and to be in person.
Okay. Any questions or comments from the board before we adjourn? Okay, Dr. Gardner, you got anything? Okay. All right, thank you very much, everyone, for being here, and thank you for all of your work. Like I say, I think we got a lot accomplished today. We will hope the proceedings go forward on the sewer issue, and we have something good to report next time. So we'll see you all in March. Thank you.
Thank you all.
Thank you very much.
Thank you for all